Hi there, my name is Kristen. This is my intro video to this whole series. However, I am actually 3 weeks into my recovery from my surgery at this point. I had shot an original video. That's my dog, he's noisy. I had shot an original intro video before all of this started, and I've scrubbed through it so many times trying to pull out what I could, utilize anything from it, but I was so sad. Like, I'm not going to put that up. So, now that I better understand my situation, now may be a good time to just do this and give you my backstory and what this whole journey has been about and has meant to me and where we're going from here. So about a year ago, my mother, who is 70, was diagnosed with her second breast cancer. She was first diagnosed about 10 years ago with stage 4 ovarian cancer. We were sure she was not going to make it, but she's a fighter, and she did. In the interim, she has also had melanoma. So we should have known at the time that something strange was going on. Also, about 10 years ago, one of my older sisters was diagnosed with breast cancer when she was 40, which is kind of a young age from what I've read. It is, a fairly young age to be diagnosed. So, with the two first-degree relatives having been diagnosed like that, that should have thrown up some red flags for me, but nothing really came about that until this year when I really started going to the doctor and they were suggesting that I get some genetic testing done. So at the time, I just wasn't ready to go through with any of that or to get involved with any of that. Knowing myself, I probably thought that it was more difficult and confusing and unnecessary than it actually was. Unfortunately, it did turn out to be quite necessary. So when she was diagnosed, my mother, when she was diagnosed with her second breast cancer, even though she said that she had done the genetic test before, and it had come back negative, the doctors were pushing her to go ahead and redo it because they can check for so many more genetic markers now. I think it's up to 48, or it's crazy the amount of markers they can check for. So she did redo the test. It did come back positive for BRCA2. At that point, my older sister, who had had the breast cancer, she went in for her test, and kind of in conjunction with her, I think like a week after that, I decided, yeah, you know what, I'm gonna go ahead and I'm just gonna try to find somebody to do this. So I was told by my main doctor, my PCP, to get this test done, and she'd made referrals. Now, I was not under the impression, or I guess I was just confused about it. I didn't know I actually needed to go through a genetic specialist to get this test done. I thought I could just walk up to a lab, ask for the kit, and have it done. And so that's what I did, like, to keep it less confusing and, whatever. So I did that, and they, for some reason, just gave me the kit, and we did it there at the lab, and they took the blood and they sent it off. And I'm sitting around waiting for a really long time for these results to come back. And it was about, like 2 months later that I get a call from the lab saying that they were not processing my test, that they had stopped all processing of my test until I could get like the go-ahead from a genetic specialist, because only then it would be covered under my insurance. I didn't know that. So I did start digging into my insurance and try to start utilizing them in the way that you're supposed to. I found a genetic specialist in my area, so I set up an appointment with her, and I went in to see her, and I talked to them a bit, and they saw that my mother, had just come back positive like 2 months before, and they knew about this and they told me about it. They told me that I could just retest that day through a different company, the company that my mom went through, for free. Like, they wouldn't even ask for my insurance, nothing. I would pay nothing because I had made it in like right in the time frame. You can do that if you have a first-degree relative who does the test, and I believe they have to test positive, and you make it in a certain time frame. I think it's 2 months. You get the test for free, which is fantastic of that company to do. So fast forward 2 weeks from the date that I took the test, and the results had already come back. I had tested positive for BRCA2 as well. Oh, I forgot to mention, right before that, we found out that my older sister had tested positive. Her results had come back, and she had tested positive. So, that's great. We're all really happy at that point, as you can imagine. I got on the gerbil wheel, which is how my genetic specialist called it. She was like, okay, you're, welcome to this world, because you're going to be in it for a while. You're going to feel like you're on the gerbil wheel. So we set up some screening for myself, some breast screening. And at that time, I actually discussed with the genetic specialist my options, depending on, what came back from any of the screenings. I could opt, if they came back, clear or whatever, I could opt to do a biannual breast screening thing for however long. I'm 33, I'm fairly young. Even with the BRCA2 diagnosis, the chances that I would have breast cancer this young are so low. I really didn't need to worry about anything for a couple of years, or so I thought, unfortunately. But I told her, at that first time that we were talking about the options, maybe I will start thinking about what I want to do to just get ahead of this thing, because I don't feel like it's a matter of if, it's a matter of when, and I want to get ahead of it. I never want to hear the words, you have cancer. Of course, nobody wants to hear those words ever. Of course. But I thought I was lucky, because it was like being given, a glimpse into the future. I was going to use the opportunity, get ahead of it, and I told her, I want to do the surgery. Let's do this. If there's a surgery out there and it's going to put me at even lower risk than the rest of the general population of getting breast cancer, of course I want to do it. Of course. Why wouldn't I do that? So that was always going to happen, the surgery. In the meantime, we're setting up the screenings. I opted to do the MRI because I had always been under the impression that the mammogram hurt for some reason. Not the case. So I went in for the mammogram, and it did come back with abnormalities. A couple of spots that were, just abnormally shaped. So then they wanted to do follow-up screening, which was the mammogram and an ultrasound, and they did that, and both of those confirmed the abnormal shapes. So that meant biopsy time. And they scheduled me for 3 core biopsies, the first one being the stereotactic biopsy, which is a very it was horrendous for me personally. I was traumatized. Like, it was so bad, but it's incredibly accurate, and yeah, that is the one that came back with the diagnosis, or with the positive result for cancer, for invasive cancer in the left side. By the time I got that result back, the positive result for the invasive cancer, it was 2 weeks to my surgery, the surgery that I was always going to have. It just kind of lined up that way. So that's kind of the backstory and what all led up to having the surgery, electing to have that surgery. Unfortunately, I didn't get to it in time, but they said when I talked to the breast surgeon that it looked like it was going to be a stage 1, so treatment shouldn't be too invasive into my life, but there would probably be treatment, and I would need to see an oncologist after the surgery. Furthermore, unfortunately, because of my BRCA2 diagnosis, at some point I would need to see a gynecologic oncologist as well and set up biannual pelvic exams with the ultrasound thing. So 2 pelvic exams a year until it is time to get my hysterectomy, which I am going to opt to do as well, because I don't ever want to hear these words again. You have cancer.